Hey everybody, this is Dr. Paul Thomas with Plum Health DPC here in Detroit, Michigan. And this week I get a really nice email from Dr. Harsha Mool of the Physician Estate. And he had a ton of questions about what direct primary care is. So without further ado, I'm going to dive right into all of these questions and do my best to answer as many as possible in a short amount of time. So first up, background. Who am I? Why did I do this? Well, I started volunteering at Cass Clinic here in Detroit for homeless and uninsured folks when I was 17. And I really loved taking care of people. But the further and further I got into my training, the less and less time I had to spend with my patients. Until I got to the end of my residency, I was spending like 10 or 15 minutes per patient and spending a lot more time charting or writing things in the medical record. I thought this was really unsustainable. I felt burnt out. I didn't want to do that anymore. So I wrote a business plan in the last year of my residency, and I launched my practice, which is Plum Health DPC. And 4 years later, I've been doing really well with the practice. We've grown, we've hired 2 more doctors, and we have a second location now. So what made you develop an interest in direct primary care? What were the motivating factors? Did you pursue any formal education or training that focuses on DPC? If so, what was it? So I developed an interest in direct primary care because I felt like it was the only way out of a dysfunctional medical industrial complex. And so I didn't have any formal training in this. I wrote a business plan. I worked with a good friend who started a suit company, of all things, to write a business plan. And then I went out on a road trip. I visited a few mentors across the country who helped me formulate my plans and refine my business plan and make it in so that I could develop a thriving practice here in Detroit, Michigan. What about Plum Health? What is this direct primary care platform? So what is Plum Health as a platform that specializes in direct primary care practice? What is its unique value proposition? And tell us the story behind its creation. Well, Plum Health, we believe that healthcare should be affordable and accessible for everyone. So we really do our best to lower the cost of healthcare in Detroit and beyond. And what that looks like is we contract with Quest, and we contract with a local imaging vendor, and we contract with a medication wholesale supplier to lower the cost of all of those things. So if you come in for a lab draw, you might get a TSH for $6 at our office. Actually, you will get a TSH for $6. That's what it costs here. But if you go to the hospital, it might cost you $100 or $125. So we really try to reduce the cost of healthcare for people. We do that for meds. Let's say you need an amlodipine. It's 1 cent per pill in our practice. So if you need 30 tablets or your 30-day supply, it's going to cost you 30 cents. Our unique value proposition is that we have time with our patients because our patients pay a monthly membership to be a part of our practice. We have this nice recurring revenue from all of our patients. We then get to spend more time with them as an individual. We usually have 1-hour appointments or 30-minute appointments with our patients, and we can really listen to them and take care of all of their concerns and not just like 1 or 2 questions before rushing them out the door. Generally, how do you help educate physicians in the U.S. who are interested in starting their own direct primary care practices? Do you provide any services, courses, coaching, etc.? I'm so glad you asked. Basically, I've written 2 books about this. The first book is called Direct Primary Care, and it really focuses on how direct primary care serves people in the greater healthcare ecosystem, how we can lower the cost of healthcare for everyone, like how we lower the cost of meds, labs, imaging, etc. It's all in here, and how we've done this in an equitable and sustainable way in our hometown of Detroit, Michigan, where the median household income is only $26,000. We've made this work in a low-income community, and we've had broad support of all people, all spectrums, all ages, and income levels support our practice. For direct primary care, how to start and grow your direct primary care practice, because we've had so much success here in Detroit, and because I've been a speaker at the American Academy of Family Physicians Direct Primary Care Conference and the Nuts and Bolts Conference down in Florida, I've had a lot of people reach out to me and ask how we were successful, how we did this. To answer that, I kind of wrote a tome. It's called Startup DPC, How to Start and Grow Your Direct Primary Care Practice. It's pretty long. It's just under 500 pages. And I really break it down step by step on how to start and grow your direct primary care practice. And I've got a ton of great feedback on this book. We now have like 13 five-star reviews on Amazon, and we've had a lot of people reach out and say how impactful the book has been for them. And we've helped other doctors launch their own practices. I also launched, I do a consulting business. I've been doing consulting throughout this. So people pay me some money each hour that I consult with them. And then I also have taken everything I've learned and I put it into some courses on my website. It's startupdpc.com. And really walk doctors step by step through how to start and grow their practices. And I go beyond just the words and I show you how to do it, like physically, how to do it online, and how to leverage your Facebook page and social media channels to grow your business, etc. All right, that's out of the way. What are the challenges and milestones in your direct primary care practice? What are some of the mistakes you made when you're starting out with your direct primary care practice? So the biggest mistake was I was thinking too small. I should have hired a medical assistant sooner. I thought I could do everything by myself, and I could. I could draw all the blood. I could collect all the lab samples. I could count all the meds. I could answer all the phone calls. And I did that up to about 450, 500 patients. And then I hired a medical assistant. But as soon as I did that, it freed up so much of my time to market the practice and do the kind of outreach that will help me grow my business. And so my biggest mistake was not hiring somebody sooner. All right, next question. If you had to redo the whole journey, what would you do differently? I wouldn't have done much differently, maybe just hired somebody sooner. I think as a business owner, you like to control everything, but sometimes you have to delegate and relinquish that control so you can focus on your strengths to help you grow your business. All right, a few special milestones that you achieved on the direct primary care journey. So one of those big milestones was hiring a medical assistant, hiring another doctor to help me lower the cost of healthcare in Detroit. This has been really exciting. I'm really happy to share it with my practice partner, who is Dr. Raquel Orlick. A big milestone for me was getting to 500 patients. A big milestone for Dr. Raquel was getting to 200 patients. Now she's over 250 patients. She's getting close to 300 patients. So those are the kind of milestones that we celebrate because we're actively lowering the cost for healthcare in our community. We're helping patients. We're liberating doctors from the dysfunctional fee-for-service medical industrial complex system, so to speak. So all of that's really exciting. How do you see direct primary care evolving over the next 5 to 10 years? How does the political climate or polar political opinions affect the evolution of DPC? So I only see direct primary care growing over time because people hate having to deal with their insurance for their basic healthcare needs. It puts up so many barriers between people and their doctors, and DPC doctors are truly problem solvers. We go above and beyond to solve problems for our patients and make their healthcare journey easier. And so when you have doctors actively working on behalf of patients, it's only going to grow because patients see the value in that kind of work that doctors provide. As for the political climate, even let's just say Medicare for all passes, which this is not a platform of Donald Trump. It's not a platform of presidential candidate Joe Biden at this time. Neither of these political parties want to see Medicare for all at this point. But let's just say, even if it does pass 20 years from now, the United States government will never be able to outlaw elective procedures, elective surgeries. Americans are always going to be able to opt for paying above and beyond their health insurance for things like breast augmentation, Brazilian butt lift, fat redistribution, plastic facial surgery for rhinoplasty, or whatever. Or you may even be able to pay over and above your insurance to have like medical assistant or nursing aide come to your home and take care of your aging grandfather or grandmother or aging mother or father. That's never going to be illegal in the American healthcare system. So I don't foresee paying above and beyond your health insurance for better healthcare experiences a la direct primary care or concierge medicine. I don't ever see that being outlawed in the United States of America, period. All right, favorites. Oh, actually, I'm skipping something. Direct primary care versus traditional fee-for-service. In a nutshell, what do you think is the major difference of direct primary care versus traditional fee-for-service? In a nutshell, the number of patients. A fee-for-service doctor has to have 2,500 patients, and they have to see 1% of their panel each day. So they have to see at least 25 patient visits a day. In our model, we only need 500 patients to have a successful, robust, thriving practice where we make about the same amount of money as a fee-for-service doctor. And so with that being said, I have 5 times fewer patients and I have 5 times more time with each of those patients. And that makes a huge difference. All right, next question. Why should a patient consider enrolling in direct primary care practice over the traditional fee-for-service? Well, just going back to the last question, you are going to have 5 times more time with your doctor, and you're going to have your doctor's cell phone number and email address. You're going to be able to reach out to them whenever you need them and not the other way around. We're not fitting you into our schedule. We're making time for you anytime you need us. All right. If you are explaining the direct primary care to a layman who doesn't have a medical background, what would be your 2-minute explanation to make him or her understand direct primary care? Let's see. We really believe that healthcare should be affordable and accessible for everyone. You should sign up for a direct primary care practice if you want to have your doctor's cell phone number, if you want to be able to text your doctor anytime you need them, and if you want to have a better healthcare experience. Like, I meet my patients at the door, I shake their hand, I bring them back to the exam room. They have my undivided attention for 20 to 30 minutes to an hour if they need it. And I help them with their medications. I fill their medications in the office. We draw your blood in the office, and you walk out the door with your medications in hand. You don't have to go to another pharmacy because we take care of everything in-house. And if you want that kind of service for yourself and for your family, or for yourself and for your small business, or for yourself and your big business that you run, we're happy to help you. And we do that all the time for our patients. And we really deliver a high quality, high value service at our practice. And our reviews on Google and on Facebook and on Health Grades, they speak for themselves. All right, thank you for that. Next up, favorites. Favorite book that talks about direct primary care. All right, well, I have 2 favorites. I happen to have written them both. Startup DPC is an awesome one. It's on Amazon. And then the Direct Primary Care Cure for Our Broken Healthcare System is also on Amazon. Pick those up. You'll really understand my ethos and the ethos of the direct primary care movement. I took a lot of time researching and writing these, and they're great. You'll see by the reviews on Amazon why they're great. People have a lot of great things to say about them. My favorite book in general about business, let's say, is Crush It by Gary Vaynerchuk. If you want to learn how to market your business, your startup, your direct primary care practice, you can learn a lot from reading Gary V. Next up, as someone who is an advocate for direct primary care practice, what is your favorite resource for direct primary care? I'm going to say my website, Startup DPC. I really took the time to compile a lot of the resources in the ecosystem and give it to you in a palatable, easy to understand, easy to digest format. Favorite bloggers that have the same passion as you when it comes to direct primary care? I don't know. I blog a lot on this subject. I haven't really seen anybody outblog me on this, so check out our blog, startupdpc.com/blog. See for yourself. It's all there. My favorite quote. I do have a favorite quote. I included at the front of my book, and it's from Theodore Roosevelt. I'm not going to read the whole thing, but in short, it's not the critic who counts. It's not the man who points out how the strong man stumbles or where the doer of deeds could have done them better. And it's about daring greatly. And it's the man in the arena quote, where, as a DPC doctor, you are the man in the arena. You are getting your face bloodied and dirtied. And some people will criticize you for doing that. But for us, we know that we're lowering the cost of healthcare. We're making healthcare affordable and accessible for everyone in our communities and beyond. And that's what matters, is the action. Tips for physicians who are planning to start their own direct primary care practices. Many docs find it challenging to start their own DPC practice. As someone who's been in the DPC business for quite some time now, what do you think physicians should first do when they are starting out? Any tips or strategies you highly recommend? Okay, well, this is going to get redundant, but I really recommend you read the book because I put it all in there. But my biggest tip is that doctors think that when they start their direct primary care practice, it's for everyone. You ask them, who's your ideal customer? And they'll say, oh, everybody. But it's not true. You really have to hammer down and hone in on who your ideal customer is. If you don't, you're going to try to serve everyone and your business is going to fail. Let me just give a illustration. For example, Facebook is one of the largest businesses in the world, most successful business in the world. They didn't start by serving everyone. They started by serving a handful of college students at Harvard. And then it grew college by college. And then it became a place for everyone. So just keep that in mind. You really have to find your target audience and hone in on that. All right, that's where we're going to leave it here because my patient is walking up to the door and I got to meet them at the door and shake their hand and let them in. So have a wonderful day. Thanks so much for the invitation to do this. Thank you, physician estate community. And please let me know how I can be helpful in the future. Hit me up, Paul at plumhealthdpc.com. If you want to call me 313-444-5630. Check out our website, startupdpc.com. You'll find a ton of resources on how to start and grow your direct primary care practice. Thank you again and have a wonderful day.